All right, good evening, everyone. Welcome to our information session with the doctor, Q&A with the doctor. I'm excited about this evening because I get to introduce not a dear friend, but my sister. Our families have known each other for decades. And so I can call Dr. Edwards my sister. We grew up together. We were raised together, and I'm so proud of her and her accomplishments. Let me just say a few things about her. For those of you who don't know her, first of all, she's an ordained elder within the AOH Church of God denomination, and she's a member of the First Emmanuel Tabernacle Church under the leadership of Bishop Wade Jones, and I believe that's in the Hill District because I believe my high school buddy, Mike Jones, I believe, is also an elder there as well. So anyway, but Dr. Edwards has been in the medical field. She's been an internist for over 28 years, mostly working for Century 3 Medical Associates, which is now an affiliation of Allegheny Health Network. But in 2016, she moved over to Gateway Health, where she has been, and she's also chairs the Health Equity Committee. She's been active within the Gateway Medical Society, which is a subsidiary or is under the umbrella of the overarching American Medical or National Medical Society, or National Medical Association, I should say, which is the racial, ethnic, or basically the Black society or organization of physicians, which was started years ago because Blacks were not allowed in the American Medical Association. So within the Gateway Medical Society, where Dr. Edwards has been a member since 2004, she's served as a treasurer, she served as secretary, she served as vice president, and she served as president, where she accomplished a lot of things as president of that organization. In 2014, she was named Physician of the Year by the Gateway Medical Society. So she is very active. She is very passionate about health equity, which is something that we all should be concerned about, which we've all been victims of over the years, over the decades, over our lifespan, is health inequities. So I'm happy to bring to us Dr. Anita Edwards, as she's going to share with us from her professional experience, the issues of COVID-19 and influenza. Welcome, Dr. Edwards, my sister, my friend. Welcome.
Thank you, Reverend Dr. Welsh. And I said I had to remember to call him that because he's always been Johnny to me. And as he says, we have grown up. His grandmother was my Gaki. And we grew up in the same houses and have always spent time together. So I am very blessed to be here today. And I am very thankful that I am able to speak to you all today. I have to say, Mrs. Rankin has made this very formal, and I don't like formal speeches. So I'm gonna try to deal with it. Ms. Rankin, am I controlling the screen, or are you? Who's controlling the slide?
Rhonda, are you there?
Do you want me to control the slides?
Oh, I'm sorry. It's up to you. Whatever you feel more comfortable with.
I'll try it. I'll try controlling because I don't want to go through them all. So I'm going to try to make this as I'm sorry, people. That's the problem with trying to do slides and presentation at the same time. Let me. Nope, wrong one. I'm sorry. Give me just a second. Which one did I just show you all? Okay, so I'm going to try to go through, especially these slides, kind of quickly. I hope most of us already know about COVID. I said I can't believe we have now been in this for a over a year and a half. It was named COVID-19 because it started in 2019, and at present we know that we're already into 2021. So who would have thought that we would have been in this pandemic for this long? Why can't I advance slides? There we go. So what is COVID? COVID-19 was a respiratory virus. We know we first heard about in China. The first case we know was in December of 2019. People was complaining of coughing, sneezing, loss of smell and taste was the big thing about COVID, that the people had more than anything else. They could have other symptoms as fevers, chills, and diarrhea. We realized that it was something that you got when you was in close contact with other people, that it was spreaded by coughing, aerosol, small droplets, and immediately we started wearing masks. The way we started diagnosing this is, I don't know if you've ever had to have one of these tests, but they take a swab and stick it up your nose, and they have to stick it up way in the back of your nose. They did do sputum samples, but that is not usually the way it's tested. Generally, it's with the nasal swab. A lot of tests take 2 days, but now we do have rapid tests that you can get almost back in an hour or two. And there's about 3 different kinds of tests. Treating it, we know generally a lot of people was able to treat themselves at home, but we do know that many people have been extremely sick with this, and they've had to be put on ventilators in the hospital. And the sad part about it is that many people have died. How do we prevent it? As we always know, and I think this is the biggest part that we, hopefully if we don't come away with nothing else, is that we need to wear masks. I think, you know, we kind of got complacent for a while and thought that it was okay not to wear a mask, but if you're in a large crowd and if you're in an inside of a building, I really suggest you wear a mask. And then try to still social distance. I said, as soon as they told us things were a little bit better, I wonder why people thought they had to get down on my neck and breathe on my neck. We still should be trying to keep some distance from people that we do not know or do not know their other contacts. And then still, we should be hand sanitizing. We should be washing our hands after we have been out in the public, or if you're in the public, use hand sanitizer, although you can't, maybe don't have water, but you can always still use sanitizer. I think if you don't get anything else out of this talk, because not only as we talk about the flu, those 3 things don't prevent COVID, but we have found out, and we always knew, that they also prevent the flu. And they just about prevent all viruses and bacterial infections. So especially if we would wash our hands, that is one of the biggest things I think we can always do for ourselves. So we know that there's there's actually 3 vaccines. Originally, there was the Pfizer that came out. Originally, it was for people over the 18, but they did get, they were able to get it where they can give it to 12-year-olds. And now I just heard, hopefully by October, they're hoping that they can start giving it to 5 years old. It is 2 shots, 21 days apart. And as far as we know, you get 95% effectiveness in preventing COVID illness after you've taken the 2nd dose. It says here 1 week, but generally they tell you you should wait 2 weeks to make sure that you've had full immunization. The Moderna, very similar. It's also 2 shots. They give it 28 days apart. They can go longer. I believe they can actually go almost up to 42 days, but it is recommended to get it about 28 days apart. It is about 94% effective after your 2nd dose. And again, it can be given for children 18. As we know also that these vaccines are not the virus. I think that was one of the biggest things that people were really concerned about, but they are something called messenger RNA. It's introduced into your body. The body sees a spike of the protein and then knows to make antibodies against it. So that if you're ever introduced to the actual virus, the body recognizes it and then is able to mount an immune immune response quickly so that you can fight off this virus. But it is not the virus. Again, we know this is a 2-dose, both for the Pfizer and the Moderna, and we've already talked about that, so I'm gonna skip that slide. And then lastly came out the Johnson & Johnson. Again, it's recommended for 18-year-olds. It is effective after 2 weeks. It is only 1 shot. It has about 85% effectiveness after about 2 weeks after the injection. It is not made with the RNA. It is made with another virus that has been disabled. It is not the coronavirus still, but it is a virus that kind of sends a message to your body. So again, your body is able to start replicating and making antibodies so that if it does see the coronavirus, it will be able to fight it off. The cost, I think some people get concerned about the cost, but we realize this has been free. No one should be charging you for this virus, for this vaccine. If you're being charged, then you need to question that. All insurances have been accepting it, and the government actually has been paying for it. When it started out, you had to find places, but now it is just about everywhere. You don't usually have to find a problem. Usually you can find a free clinic, many neighborhood events, and then most of the pharmacies right now are also giving this vaccine. So again, that just talks about how to get the vaccine. And this is also a website, vsafe.cdc.gov, that you can go if you want some more information. So is the vaccine safe? That's always been the big question for most people. And at this present time, we don't know anyone that has died from the vaccine, but we definitely know people who have died from the virus. So is it safe? Yes. Everything has side effects. You can take a Tylenol and you can have side effects. You can take an aspirin and you can have side effects. So everything is going to have some side effects. And if we do know that if you are have severe allergic reactions, then you should definitely consult with your doctor before you decide to take the vaccine. But for the most part, these vaccines have been very safe. And now Pfizer has gotten full accreditation from the FDA and is no longer just emergency use. And I believe Moderna will come up and get that also, that approval also. Just some quick myths that we always hear. Again, talking about severe side effects. And for some people, if you've gotten the vaccine, many people talked about chills about one day afterwards. Seemed like chills was one of the big things. They had fatigue, muscle aches, very much like you had the flu symptoms for a very short period of time. But again, it was nothing like having the actual virus. You know, one of the myths was there a microchip being planted in your brain or in your skin? And you know, and not jokingly, but I said the government already is following us. I think they know more about me through my cell phone and my tablet than they will ever know by a chip being put in me. I don't know about you, but if I Google anything, all of a sudden I got thousands of websites coming up. So they already know about us, but no, there is no microchip being put in us, and there's no way that they are tracking us through this vaccine. There's also, they're not altering our DNA. One, this is not DNA, it's RNA, it's messenger, and messenger RNA is just what it's called, is a messenger. So it takes messages, but it has no way of altering or changing your own DNA. This was not developed in fetal tissue, again, because it's not even anything that's live. It is totally something that was manufactured. So if it was manufactured, you say, how did they make it so fast? And one of the things we have to understand, we've had several SARS viruses in the past. We've had other things that they had to try to come up with vaccines or cures for. So they were already working on this method, especially the messenger RNA method, to cure or make vaccines. And so it wasn't a new technique. It was just something that they revved up, and many people started working on it at the same time, which is something that usually doesn't happen. You usually don't have that many companies working on one treatment at the same time. And so they were able to come out with it quicker. Also, we understand that the Johnson & Johnson is definitely a vector in which we already had to use to make vaccines. So it was not new. If you had COVID and you recovered, you know, the thought was that you didn't need to be vaccinated. But now we're knowing, even if you had the vaccine, that you may still have to have a booster to this. So we realized that the immunization that you formed, and the immunity that you formed from getting the virus may not last. And so therefore it is definitely recommended that you still get the vaccine. And again, I think I've already talked about this. When people have not died from the side effects, we know you can have severe reactions to it if you have allergies, but no one has died from the vaccine. Hesitancies, and especially as African Americans, we always have some concern about the trust we have for both the government and for the medical field. And I think that's real. Even as I have had to go through the medical field, I always tell people you need to have an advocate for yourself. You need to have someone who is with you. So I think the biggest thing we can always do to educate ourselves about the vaccine, which is why you have talks like this, where you can ask questions. You can just about Google anything, but make sure it's from reliable sources. Make sure it's not just from someone who has come up with their own theory, but that they have data behind it. So things like Tuskegee syphilis study is real. We know that. We know there was experiment on females by gynecologists where they tried to test us for pain. There was a study in Mississippi where they were taking out appendix and sterilizing females when they told them they were taking out their appendix. So yes, there has been times when we have been used inappropriately for treatment. But this is one time we have to realize that this virus has caused us as African Americans more death than just about any other race of people. And so therefore we need to make sure that we are protecting ourselves and getting this vaccine. So how can you help? Things like this. Definitely coming and learning, attending talks, educating yourself, educating your family, educating your church, discussing openly with other people. I think about my nephew. It took me the longest, and I don't even know that I was the one that convinced him, but I kept talking to him and asking him why, and he was giving me the things I just talked about, that he heard people had died from it, or that it actually gave you the virus. And finally I said, well, your grandma, because he trusts his grandmother. And I said, your grandmother got the vaccine. I said, have you talked to her? And he went and talked to her, and she said, no, I didn't have any problems. I was fine. And she didn't have any. And with that, he finally went and got the vaccine. I think a lot of young people are very doubtful. And I think that's where we need to listen to them and help them understand the facts of how to, so that they will be comfortable about getting this vaccine. So just some other real quick questions, and then I'm gonna try to move on. But again, you can't get COVID from the vaccine. And if you're pregnant or breastfeeding at present, they say that it is definitely okay for pregnant women and breastfeeding women to get the vaccine. And as I stated, can children get it as of yet? Pfizer, we know, is down to the age of 12. I forgot to correct that on this slide. It's an older slide. Moderna is still 18. Johnson & Johnson is 18. But Pfizer is hoping by October to be able to go down to the age of 5. We realize, though, do not give your children the doses that are given for adults. Children are not little adults, so they do have to modify and make sure that they're giving the children the right dose. So that's the end of that presentation. I don't know if there's any questions, but I'm gonna go on to a second presentation and then we can probably go to questions. So this is probably more of where we are now in the future. Give me a second. So what's new about COVID? And as we stated, this has now been going on for 1.5 years, and we started thinking when we were getting the vaccine starting in March, oh, this will be over. And in June and July, they started letting up all the mask mandates and started telling us we could go outside and we could do things and we could travel. And then all of a sudden now COVID is just as rampant as it was probably almost 1 year ago. So what happened? What happened was these variants. And one of the main ones that we know about is the Delta variant that has happened. So what is a variant? As with most viruses, they're able to do something called mutation. They're able to change. They're kind of smart. And so as you try to fight them, you know, they always tell you don't take too many antibiotics because germs can mutate and develop resistance. Well, these viruses are figuring out how to do that also. So as they see that your body is either learning how to fight it off or they see that we are getting the vaccine, they are learning to make changes. And Delta was not the first change. It's called Delta because it was the fourth one that we definitely know of. And there's probably some other changes, but these are the ones that have been extremely well known. There was Alpha that started out in the United States in 2020 and was also in the United Kingdom. There was Beta that was in United States in January of 2021, and it started out in South Africa. And then there was Gamma that I think started out from Brazil or Japan. And now we have Delta, and Delta was started very much so, I believe, in India. I have some friends who parents and family was over there, and they were very concerned because this was just rampant over in India. And for some odd reason, I think we thought it wasn't going to come to the United States. I'm not sure why, but in March of 2021, it became prevalent here. And it is really what they are mostly seeing in the hospitals now is this Delta. So the symptoms of the Delta is just almost the very same as those of always COVID-19. Again, you get your headaches, your sore throats, your runny nose, cough, fever, loss of taste and smell, and vomiting and diarrhea. The intubation period is for about, sorry, I didn't mean to do that. Intubation period is for about 4 to 5 days. And people can have symptoms anywhere from 2 to 7 days after they've been exposed. And you're actually contagious for, especially with the Delta, they usually say about 7 to 14 days, but they're now finding out with Delta that you can actually be infectious for probably about 19 to 20 days. Not fun trying to control. What did I do? Excuse me, everyone. There we go. Again, as I said, this is a more contagious type virus than the others. It is more contagious than the common cold, and the common cold is very easy to catch. Definitely more contagious than the flu. And you know how protective we've been about Ebola. If you hear someone has Ebola, everything shuts down, everybody's quarantined. But here we have something that's more contagious than Ebola. Right now they're saying if you don't have the vaccine, you are probably 11 times It's 11 times more that you're going to get this virus, and it's 10 times more that you will be sick and in the hospital with this particular virus. So this virus is definitely finding out that it is more contagious and more serious than any of the other viruses that we've seen. The good thing is that the vaccines that we have so far all seem to protect us against this virus, even with the Delta variant. So it is still important that we continue to get our vaccines. Now, when you get the vaccine, it doesn't mean that you still can't contact the virus. You can still catch the virus, but most likely if you have been vaccinated, you will not be as sick, and you definitely shouldn't die, we hope. And most likely you'll be able to avoid hospitalization if you've had your vaccine. So therefore, yes, you can still contact the virus, and you can still transmit it to others. That is why it is still important to get your vaccines, because you can still give this to older, or anyone, but especially to our older people. And what they're seeing, and that's probably because the children can't be vaccinated, that the children have no immunity against this. So now we're seeing very sick children. With the other ones, they said, the children were okay. And that's really a concern, because our children now are back in school. And so everyone is concerned about what's going to happen for these next couple of months as all the children are returning to school. Many schools are fighting about wearing masks, and they don't want to do the universal masking. So our children are really at risk. So it is very important to try to protect your children, grandchildren at this particular time. So what can you do? I think I started off this way. The biggest thing is you need to mask. You need to mask. I think if you're outside and you're running and you're by yourself, or, there's a lot of distance between yourself and you're vaccinated, you probably can get away without wearing your mask. But if you just want to be totally protected, it is always best to wear your mask. And definitely in public places that are closed. If you're in a closed place, try to open the windows, try to have good ventilation, and again, wear your mask. They tell you to try to spend short times around people, less than 15 minutes, to stay around someone, so that if they are infected, you're limiting your amount, the ability of you to get that infection. Again, as I already said, open your windows, make sure you have good filters, and again, wear your mask. So just real quickly, because I was also asked to talk about the flu. And what is the difference? That's the big problem. There's not a lot of difference between flu and COVID. Both of them are respiratory illnesses. Both of them spread by aerosol droplets. So they're both spread the same way, by someone coughing or speaking. And I know in church we love to sing, and so singing will definitely spread germs. COVID is more serious, as we have found out, but you can still die from people. That's why we had a vaccine against it, because people were becoming very ill, especially if they were older or had other chronic illnesses. They definitely still could die from the flu. The period to get the flu is shorter than COVID, and usually you experience symptoms much quicker. The symptoms are very similar, so it would be very hard to separate the two. Both of them give you fever or feel feverish, chills, cough, shortness of breath, fatigues or malaise, sore throats, running and stuffy nose, muscle pain and body aches, headaches, vomiting, and diarrhea. So how do you tell the difference? You really can't. Even in the hospitals, they can't tell. Generally, if people come in with these symptoms in the hospital, they will run both tests on you. They will run a test for COVID-19, and they will also run a test for the flu. So we really cannot tell until we've actually done the test. Can you be infected with both? Yes, you can. You can have both of these viruses at the same time. Why we're having these talks? Because it's very important to not only get the vaccine against COVID, but also to get the flu shot. One of the things we did find out this year was because everybody was masking and staying in and quarantine, even though we didn't have the vaccine against the COVID as of yet, the flu was almost non-existent. This was probably the first year that they really didn't have a lot of flu or complications from the flu. And we know it's because people were wearing a mask and socially distancing. So as we now are back out and moving and going back to work and out in the public, it is really important that we get both vaccines. How are they spreaded? I already said they're both respiratory. So if someone has one, they can definitely spread the other ones or two. And then what are the complications of these? One of the biggest complications is we know that people get pneumonia, both with the flu and with COVID. That is one of the biggest complications is getting pneumonia. So many times people have recovered from the actual viruses, but because of the pneumonia, that is why they're sick and that's why they die and why they end up on respirators. Ooh, what did I do? So again, that's really the end. We can take a lot of questions, but these are again some sources, the CDC, Allegheny County, and we always say we welcome you to contact us as Gateway Medical Society, and this is the information for our site. And I thank you.
I didn't hear you talk about the mu variant. I'm hearing mu. There's a mu variant coming. Can you elaborate on that? Is that really the truth, or how many more variants are they predicting? Like, when is it gonna? Are we gonna go all the way to Z? Like, when will it stop?
The last question I don't know that we know the answer to. So there is a great possibility that this will always be a variant. My personal opinion, so I always like to say when I'm saying my personal opinion, I don't think COVID is ever going to go away. I think just like the flu doesn't go away, COVID most likely is not going to go away. So that means there's probably always going to be some variant. So there's always the great possibility that we will always have to get a booster or some kind of something to help keep it under control, just like we do with the flu shot. That is why you have to get a flu shot every year, because as the flu shot mutates and changes, they then change the mixture of what they do to the vaccine so that it will cover whatever mutations are in the flu vaccine at that particular time, the influenza virus. So there is a great possibility that is the same thing that's going to happen with this virus. I do think we will probably get to a place, though, that we don't have to walk around with masks all the time, and we probably can be closer to each other. That is why they talked about herd immunity at one point, and they still try. Because if we could get enough people immunized, just like with any other virus, if you think back, smallpox was really a problem at one point. Measles was a problem. Mumps, these are all viruses. Chicken pox, but you don't see them now. You see small cases, you'll see small breakouts, but because everybody around the people who decide that they didn't want to get the shot is usually vaccinated, then it doesn't get to spread real far. So, you get a little pocket, then everybody, and then it stops, because as long as it's just among those people who don't have the vaccinations, everybody else is protected. And that's where we're trying to get to with this vaccine. There will probably always be pockets, always be people who don't have the vaccine, will maybe travel, go somewhere, and they pick it up and then they bring it back. But hopefully if enough of us have the vaccine, then we won't have to worry about it as much. So yeah, there's definitely some other mutations that they're talking about. That was your first question. Yes, they haven't really declared them yet. I will be honest, I think sometimes they tell us a little later than they actually come out. I'm gonna just be honest about that thing. I think the one thing we have to do is be honest about what probably happens. Just like the booster, I mean, it was quite obvious that we were probably going to need a booster several months ago. But I think they made the decision to try not to talk about the booster so much because they wanted people still to get the first and second shot. So occasionally, they don't make always the right decision, but I don't think they're trying to harm us. I do think they're trying to protect us and trying to get us to do what they think we need to do. So, but they don't always make the wisest decision in how to do that. But is this a real virus? Yes. Is the vaccine real? Yes. Should we get it? Yes.
I have a question.
Yes.
Regarding the flu shot and getting the COVID shot, what if someone has just got their first COVID shot? Can they still get their flu shot right after the COVID shot and then get their second COVID shot?
So last year when this originally came out, they said you could not get the flu shot and the vaccine together.
Okay.
Ending that there was a period of time between the two. As what I understand this year, they will be giving the vaccine and the flu shot at the same time. And that's what I understand. But last year they were not giving them together. And it may be because the vaccine was so new, they didn't, if you got sick from one, they wouldn't have been able to tell you which one was causing which. But I think now they have more experience with both. And so therefore they can probably end up giving them together. But again, so realize it takes 2 weeks to build up immunity from any of these vaccines. So the flu vaccine should be out. Usually it's out in September. And it takes about 2 weeks to build up. Then also it is usually good until about March. They used to say don't get it too early because it would run out. But now we know that it will last. The flu vaccine will last probably from September to about March. And so we usually don't have to tell anybody to get a booster for the flu vaccine. If you're over 65, you do want to make sure you get that high dose valent flu shot and not just the regular flu shot for over 65. So just make sure that is what you're getting, either from your doctor's office or from the pharmacy. Don't just get the regular flu shot for those.